please introduce yourself.
I'm Nosheen Mahmood and I live in the UK.
What is your current profession?
So I trained as a paediatric nurse and I now am a neonatal intensive care nurse.
How did you end up joining this profession?
Throughout my childhood and my teenage years, I was always on the receiving end of the NHS. I was always a patient. And just seeing the care that I received from doctors and nurses made me want to, follow their footsteps.
If you had to choose again, what would you choose, and would you change anything?
So if I had to choose another career, I think I would possibly become a doctor. It's something that I very much, I enjoy working with my doctor colleagues, and I enjoy the sort of things that they do. To be honest, there's nothing that I would really change about being a doctor as such. I've seen the way they work, and we work well as a team, so that's something that I would look into.
How did you prepare for this profession? Did you go to school? What courses did you do? Did you go to university?
Yes, so what I did was I did health and social care at college for 2 years, which prepared me for doing the nursing course at university. So then after my college, I went on to do a degree in paediatric nursing. So I got all my qualifications, and then I got all my experience throughout my 3 years of my degree, and then I qualified.
For what age have you been working in this profession?
So I qualified when I was 22, so I've been working for the past 2 years.
During your working life, have you changed the profession? And if you did change it, what were the reasons?
I worked in various aspects in terms of employment. So I've done retail. I then went on to work in a supermarket for a short period of time. And then alongside that, I've also done a bit of teaching. And I also worked with children with disabilities, so learning and physical disabilities. So we did activities with them. So I did lots of bits and bobs. And the reason being is because the retail or the supermarket was just part-time jobs whilst I was in education full-time. And then working with children with disabilities was something that I just wanted experience in. It's part of my career that I'm in now. Sometimes you do come across patients with disabilities, so you want to know how to best care for them, which is why I did that work.
What are your personal attributes that make you successful in working in this profession?
See, I get a lot of feedback from my patients and their families in terms of the nursing care that they received, as well as a nurse in person, so me. And what I tend to get a lot is the fact that I can be quite compassionate, and I listen to them, and I think that's really important, is to be a good listener, especially in this profession, because they go through a lot. They have a lot of ups and downs, and up until they go home, to be honest. So that's one thing that definitely I think I would say is an attribute. I think the other thing is just being understanding, putting yourself in their shoes, which is really important in this profession as well.
What are the most pleasant aspects of working in this profession? How about the challenges, the difficulties you face in this profession?
So in terms of pleasant aspects, I have to say it's rewarding, seeing a patient deteriorate so suddenly, to then going home, several weeks later and seeing how well they've done in that time. It's lovely to see that. It's lovely to see, families, you create that bond with their baby, being confident to take their baby home. So that's something that I would say is, very pleasant. There are also a lot of challenges associated with this career. So for example, some of our babies can get very, very poorly. So seeing parents in distress and seeing them, anxious, it can't be nice. It's not a nice feeling for anyone. And then sadly you get some patients who don't make it, due to various complicated issues. And that can be quite sad.
Do you think this profession is overrepresented by one specific gender?
Yes. Within the nursing profession, I do feel like it's mostly dominated by females. Having said that though, it very much depends on the field of nursing that you're in. So I work with babies, so you can imagine that a grown man may not necessarily want to work with little babies. However, if you are working with adults, then I do see a fair number of male nurses.
If a young person wants to join this profession, what does he or she needs to be learning or doing before joining this profession?
So I would recommend taking appropriate courses. So for example, doing something health related or science related. which will definitely help. I'd also recommend getting some work experience as well. So whether that be working in a healthcare environment such as a hospital, or working in an elderly home, or working with children in a private nursery, then I definitely would recommend that before taking on board this career.
And do you think they also require right kind of attitude to be in this profession?
Completely. You need to have the passion to care. That's so important. You cannot be doing it just for the sake of working or just because of the salary. You need to be doing it because you care and you want to make a difference. This job can be quite emotionally challenging at times, therefore you need to have the right mindset.
Tell us a funny story about your work.
So it's quite interesting because I work in intensive care, so I tend to see a lot of interesting cases. Well, we get the odd baby who is very active and very upset and angry and whatnot. One day I think I was doing, we had to take blood tests. So it was actually, it took 3 of us to try and be there for this baby because the baby was very unsettled. So I was holding the baby, and whilst one of the doctors was taking blood tests, and the other baby was, and then the other doctor was assisting as well. So whilst I was holding, and I think I was actually feeding at the same time, and then suddenly I just felt something on my lap, and I thought, oh, it's got a little bit warm, and it turns out that the baby had actually exploded in its nappy, and it went all over my trousers too. So it's definitely an experience.
Do you get a good life and work balance in this profession?
I have to say that you have to try. It does require effort in order to manage a personal life as well as a work life, and then you have to make time in order to have an active personal life too. But having an understandable manager and having a supportive team, you can definitely have the right balance.
What would you tell a young person who wants to choose this profession?
I would say get experience. It's so important. And I'm talking about getting experience before you even embark on the journey of being a nurse, so meaning going to university. Get some experience. And life experience is what will make you you. So, expand your horizons, broaden your choices at the same time. Don't be so specific about, don't be so narrow about what you want to go into. Just, experience different aspects of nursing and healthcare, and then decide what you want to